Marshall. My name's Lisa. I'm a nurse. I'm going to do a head-to-toe assessment today on you, okay?
Okay.
At any point, if anything bothers you or you're causing any pain, please let me know, okay?
Okay.
At this time, is anything currently bothering you? Any pain, any issues?
No.
Okay. First, I'm going to wash my hands, okay?
Mhm.
And I'm going to start by just feeling around your head. And I'm going to work from the top all the way down to your toes.
Okay.
Okay. Okay. First, I'm just going to feel your head. Does any of this bother you?
Nope.
Okay. Just going to feel above your eyes. How about in here?
It's fine.
No? Okay. Now, I'm going to ask you to open your eyes, and I'm going to ask you to scrunch your forehead for me, please. Can you frown? Can you smile? Can you puff out your cheeks? Great. I'm also going to squeeze your ears. Any pain?
No.
Okay. Now, I'd like you to move your jaw side to side, please. And up and open and close. Very good. Now, I'd like you to hold your teeth together. I'm going to try to open your mouth. Very good. Just checking to make sure your trachea is midline. Okay. I'm going to come from the back. And I'm going to ask you to take a couple of nice deep breaths, please. Oh, excuse me. I'd like you to swallow, please. And again. Very good. Okay. A couple of other things I'd like to do is first I'm going to check your eyes, okay? So, I'm going to use a pen light from the side and I'm just going to check. Just keep looking right at me, okay? And again. Beautiful. Okay?
Mhm.
And I'm going to point this right at your nose. Just keep looking right over my shoulder. Beautiful. Now, I'm going to ask you to follow this pen light without moving your head. And just don't move your head, that's all. Just follow with your eyes. Okay. Beautiful. I'm just going to inspect your eyes, okay?
Mhm.
Okay, I'm just going to look at you inside. Very good. So, this is a Snellen chart to check your vision.
Mhm.
I'm going to ask you to cover one eye, please. And I'm going to ask you to say the bottom line that I point to, okay?
Okay. DEFPOTEC.
Okay, could you cover the other eye? When you're ready, please read this line.
DEFPOTEC.
Very good. Okay, I'm going to do a couple of other tests with your eyes. I'm going to ask you to cover your eye, and I'm going to cover the same eye, okay? And when I move the pen, I'm going to ask you to tell me when the pen comes into view. We're testing your peripheral vision at this point.
Okay.
Okay, so cover your eye, same eye as me. Very good. Now, tell me when you see the pen.
Now. Now. Now.
Okay, we're going to do it on the other side.
Now. Now. Now.
Okay, now we're going to do the other eye.
Now. Now. Now.
Okay, I'm going to do this side.
Now. Now. Now.
Very good. Okay. I'm going to test your range of motion a little bit on your head and your shoulders, okay? First, I'd like you to bend your head forward and all the way back. Great. And I'd like you to put your shoulder to your ear to your shoulder, please. Other side. And I'd like you to turn your head all the way to the left and all the way to the right. And can you shrug your shoulders for me, please? Very good. Now, we're going to do both of those with resistance, okay? So I'm going to ask you to push your head forward, please. Very good. And push your head back. Good. Now, try to turn towards my hand. Okay. Again. Okay. Now, try to put your head to this side. And, okay? And other side. Very good. And try to lift your shoulders for me. Okay. I'm going to do one more thing. It's called a whisper test. So I'm going to stand behind you. I'm going to ask you to cover one of your ears. And then I'm going to say something. I'd like you to repeat it, okay?
Okay.
So if you could cover this ear, please. Peach donut.
Beach donut.
Can I cover the other side, please?
Flip-flops bear.
Very good. Okay. At this point, I would also test your gag reflex, but we don't have a tongue depressor, so I'm not going to do that. Okay? So, this other thing I'd like you to do is I'd like you to open your mouth. Great. I'd like you to lift up your tongue. lift it up for me. And please say ah.
Ah.
Very good. Okay, next I'm going to work on your, I'm going to check for your lymph nodes. Next you're going to go right down to here. And on this side. Great. So just going to check for your pulse. Next, I'm going to test your arms, okay? I'm going to do some things with your arms. First, I'd like you to just hold them out. I'm just going to test to make sure you're hydrated by doing some skin turgor tests. Just going to feel the temperature. Great. Okay, I'd like you to stand, put your arms forward, and then back. Okay, that's great. I'd like you to make a fist, and spread your fingers as best you can. Okay, I'm going to just... Put your arm down for me. I'm just going to check a couple pulses. Okay. We're going to do some of those same tests, but we're just going to do it with resistance, okay? So I'd like you to put your arms out for me. Bend your wrists. And don't let me push them. There you go. Now flop them up. Don't let me push them. Very good. Can you flex your arms for me? Flex them out. Flex them back in. Don't let me pull them. Okay? Don't let me push them. Very good. Okay, you can put them down. Next, I'm going to move down to your extremities, okay? Your lower extremities. And I'm going to just look at your legs. Make sure you have no edema in your feet. Very good. I'm going to check a couple of pulses. Any pain in your legs at all? No. I'd like you to do me a favor. Can you point and flex your toes? Okay, and I'd like you to roll your ankles for me. Very good. Are you ticklish?
Yes.
I'm going to do what they call a Babinski reflex on your toes. I'm sorry, but just give me a minute, okay?
Okay.
Okay. I'm going to also examine your feet. I'm going to test your reflex on your knees. I'm going to use the end of my stethoscope, okay?
Mm-hmm.
Very good. Now what I'm doing is I'm going to start at the back, and I'm going to listen to your lungs. Then I'm going to move to the front, listen to your heart and your abdomen. And then once I lay you back, I'm going to do some activities on your upper legs, okay?
Okay.
At any point, if you feel like you're short of breath, please let me know and I will stop, okay? Nice deep breath, please. And again. Again. Just two more. Okay. Just push on your back. When I do this, do you feel any discomfort?
No.
And how about when I touch your spine?
No.
Okay, I'm just gonna tap. You feel any pain?
No.
Wonderful. Just gonna check the front now. Oh, excuse me. Can you do me a favor? Can you take 2 nice deep breaths? Very good. Any discomfort when I do this?
No.
Okay. Deep breath for me. 2 more. Okay. Now I'm going to start to listen to your heart, but first I'd like you to lean forward. I'm going to ask you to hold your breath for a second, okay? Okay, ready? Take a deep breath and hold it. Okay, exhale. So now I'm going to do some heart sounds. It's going to take me a few minutes because I'm going to go do about 5 spots, and then I'm going to go back with both sides of my stethoscope, okay? The last one I'm going to hold for about 20 seconds to listen to your apical pulse.
Do you want me to lie down?
Hmm?
Do you want me to lie down?
No, not yet.
Okay.
Okay, could you just hold out your arm for me? Very good. Just gonna go backwards now. Okay, if you could lay down and go onto your left side for a moment, please. Slightly to your left. Very good. Okay, you can lay flat now. So now I'm going to listen to your abdomen, okay?
Mm-hmm.
First I'm going to listen, then I'm going to palpate, and then I'm going to percuss, okay? At any point, if anything bothers you, please let me know, okay?
Okay.
Okay, just going to do a couple of taps, okay?
Mm-hmm.
Any pain?
No.
Okay, I'm just going to lightly palpate. Any discomfort when I do that?
No.
Okay, just stay there for a second. Okay, now we're going to go back to your legs. What I'd like you to do first is we're going to work on some moving your legs. So if you could lift your leg out straight, please, and bend it up. Could you rotate it out and in, down, and can you cross it over and come back? Very good. You can do the same with the other one. Can you out straight, please? Bend it up, go out, and come in, come out straight, and cross it over. Okay, just going to do a little resistance. So if you could bring this knee up again. Okay, could you try to push it out? Very good. And you can try to push it in, and just push it out straight, and don't let me push it down. As best you can. Very good. Other side. Out straight, bring it up, push towards me, please. Okay, push away from me. Very good. Out straight, and don't let me push it down. Very good. Okay, I'm going to have you stand up. You doing okay?
Yeah.
Okay. So I'm going to have you walk to that corner just normal, please. Just a normal walk. I'm going to have you turn around. Can you do a couple of steps on your tippy toes, please? Couple steps on your heels. Okay, could you turn again and walk heel toe back to that corner, please? Okay, now, if you could come stand here for me. I'd like you to bend over, just straight over. Any discomfort when you do that?
No.
Okay, come up. I'd like you to bend to the left and then bend to the right. And then I'd like you to twist as best you can. Okay. Holding onto the bed, I'd like you just to bend your knee up. Okay, and down. And up. Knee and down. Okay, have a seat again for me. I'm going to do a couple of other tests, okay?
Mm-hmm.
First, I'm going to do what they call a stenograph on your hand. So I'd like you to hold your hand out. I'd like you to close your eyes. I'm going to write a letter. I need you to tell me what it is, okay?
Mm-hmm.
Let me try it again.
5.
Yes, very good. Okay, other hand.
L.
Yep, very good. Okay, with your eyes closed again, I'd like to do a couple more tests. First, I'd like you to put your hand out for me. And I'm going to put an object in your hand. Just let me know what it is.
Paperclip.
Okay. The other hand, please.
Pencil.
Okay. Now, I'm going to use something, and I'm going to touch you in different places. Just let me know when you feel it, okay?
Okay.
If you can tell me which side as well, it would be helpful.
Left temple. Right arm. Left forearm. Left shin. Right shin. Left foot.
Great. Oh, I'm going to ask you to stand again. I'm sorry, I did forget to do something. You could stand with your eyes closed, okay? I'm going to keep my hand at your back just to help you balance. I'm going to ask you to stand there for about 20 seconds. Okay, here we go. Okay, have a seat for me. One other test I'm going to ask you to do. I'm going to ask you to take your heel and run it right down your shin. And the other side, please. Michelle, we're all done with the exam. Thank you so much for your time.
Thank you.